Zimbabwe's President Emmerson Mnangagwa says that the level of violence from some opposition political parties will not be tolerated. He says that this is worrisome and that the law will take effect and its application will be without fear or favor. President Mnangagwa says that no one is above the law and called on the citizens to obey the country's laws. He says that the security cluster is on high alert for any eruption of violence. President Mnangagwa has called for calm in the country ahead of national elections scheduled for next year.
What happened recently in the Nyatsime township of Chitungwiza is deplorable and should never be repeated. The nation is now familiar with these shenanigans and incidences of staged violence, which are designed to tarnish the image of the Republic of Zimbabwe, especially ahead of major international meetings. This time around, the destabilizing and violent theatrics by opposition elements are being done ahead of the CHOGM, the Commonwealth meeting in Rwanda. Shame on you. If you are a leader of a political party which thrives on violence and the insecurity of our people, then you are not relevant. Shame, shame, shame on you. The life and property of every Zimbabwean is critically important and will be protected by my government. Our security architecture are on alert. We will not stand by and watch the good image of our nation, as well as the safety and security of our people, being desecrated by rogue pseudo-politicians who receive dirty money to torment their own African kith and kin.
Hundreds of Zimbabwe's public sector health workers have gone on strike over low wages and poor working conditions. Nurses, senior doctors and radiographers are among those expected to withdraw their services.
The strike follows a worsening economic crisis that has seen thousands of health workers leave public services in the last 3 years. The cost of food and services has more than doubled recently as a result of the war in Ukraine, and the annual inflation reached just over 130% in May, one of the highest in the world. Union leaders say government has refused to engage them. Over the weekend, the government said it would double the wages in June, but the union officials say the amount proposed is still below the living wage. According to the Health Workers Union, the public health services has collapsed over the last 20 years due to neglect and poor administration.
Well, for more on this, we're now joined by SABC correspondent in Harare, Ephert Musekiwa. Ephert, thanks very much indeed for joining us. Is this strike nationwide?
Good evening, Peter. Yes, indeed, the strike is nationwide. I went to two centers in Harare today where we witnessed most of the healthcare workers who were down tools. They were singing and dancing and not attending to patients. I was at Harare Central Hospital, and I did indeed witness the healthcare workers not at work.
So some people might say, how can these staff be going on strike when they've just received a 100% pay hike?
Okay, let me break it down so that you might understand. The government workers in Zimbabwe receive two components in their salaries. There is an allowance of about $175. That's a COVID allowance that they do receive, and it's fixed in United States dollars. Then the rest of their salary is in the local Zimbabwean currency, which is the Zimbabwean dollar. And it is this component, the Zimbabwean dollar component, which was which have been hiked by 100%. And the workers are saying that even as much as they might even give them a 100% hike on the Zimbabwean component or on the Zimbabwean dollar component, it is not enough because inflation, you do know that Zimbabwe is going through a hyperinflation. So the Zimbabwean dollar component was translating to about $20 to $30. So even if you give it 100%, it's still below $100. And if you add that to the allowance or the US dollar allowance that they were getting, it's very little. One of the doctors I spoke to was telling me that in total he earns less than 300 United States dollars or less than 4,500 South African rand, which is not enough, or which does not translate to a professional of his level.
So what do the health workers want? Do they want not just more pay, but to be paid in US dollars, I'm guessing?
Yes, indeed. They say they want most of their salary, or they want their salary to be denominated in United States dollars. They are also asking to meet with the Minister of Health, who is the Vice President, Correspondent. They are saying that in the 20 months since his appointment, they have not had an audience with him. The last time they tried to get an audience with him, or the last time that they down tools, they actually fired most of the healthcare workers within his ministry. So they are appealing for an audience with the minister. They have also indicated that the working conditions in the hospitals themselves are not conducive. They want the government to improve the environment within the hospitals, to improve the environment within the government institutions where healthcare workers operate from.
What are some of those work condition issues that they are raising? What sort of problems have they described?
Well, mostly it has to do with the equipment that they protective equipment, and also just ordinary healthcare equipment that they are using. They're saying that the government has not procured most of the modern equipment that are now in use the world over when it comes to health delivery. They are asking for protective equipment. They're saying in some places they do not even have simple things like gloves. They do not even have the medication to administer to patients when they are in government institutions. They are forced, or they have to force some of the patients to go and buy or go and acquire from pharmacies some of the things that they provide for in government institutions, something that should be readily available in all the healthcare institutions that they are working from.
Has the government said anything about the strikes?
Well, not yet. I did try to get a response from the Ministry of Health, but they did not respond to my request by the end of the day. We are hoping that tomorrow, we do know that the Zimbabwean cabinet does sit every Tuesday. We are hoping that maybe tomorrow we will be able to get a response soon after the cabinet meeting from the Zimbabwean government on this issue.
I know that the teachers have got similar issues. Is there a fear that we could see these strikes move to other sectors?
Well, it's not a fear, but the teacher unions actually this evening did issue out a statement and they called for a 5-day strike starting next week Monday if their concerns are not met. They actually will be joining the they'll be joining the healthcare workers in demanding for US dollar salaries. So indeed, the teachers have also actually given the government an ultimatum that if their grievances are not also attended to, come Monday next week, they will also be embarking or will be joining the healthcare workers in an indefinite strike.
The last time the health workers went on strike, how did it end? Did the government end up conceding and conceding to the demands of the health workers? Might the same happen now?
Well, the last time, like I did indicate before, the Minister of Health actually fired or suspended all those that had taken part in the industrial action. None of their concerns were immediately attended to. And there are fears that this time around similar action might actually be taken. So we wait to see how the government is going to respond or how the Minister of Health is going to respond. We've also seen the Minister of Health withholding certificates for nurses who had also undergone the industrial action. They've delayed in issuing certificates to doctors who had also undergone industrial action as a way of punishing them for their action. So we really, people are really, or most of these healthcare workers are afraid that the result might end up with them being suspended or with them being fired from their work.
Ephert, from what you've seen, you've been to these hospitals and you've seen over time, is there a fear that the healthcare system could collapse again? And I'm saying this because we know that more than 2,200 doctors and nurses left the country last year already. So with all these healthcare workers disappearing and the ones that are left behind going on strike, desperate to survive, it doesn't paint a good picture in terms of the state of the healthcare system.
Well, Peter, I don't see any other outcome except a collapse of the healthcare system. All those issues that you've highlighted actually point to an imminent collapse. Right now, the healthcare system was actually in, for a lack of a better word, in intensive care. It was very sensitive. A lot of things were not in place. And with this strike, I think it is the final nail on the coffin. Really, the only thing or the only route or that is left is a total collapse of the entire system. Because if the healthcare workers do not, or if the remaining healthcare workers do not attend to patients, then basically the public healthcare system in Zimbabwe will cease to operate.
Ephert Musekiwa, we're going to leave it there. That's our correspondent in Harare.